Hello, today we're going to talk about runner's knee. Runner's knee is a common term that's used, so it's not a medical term, it doesn't relate to any one specific thing. It generally relates to problems related to the kneecap or patella, or the ITB, the band that comes down the side of the leg by the quad and the hamstring and attaches in below the knee and affects how the kneecap works. So that's what we're going to be looking at through the video today. Okay, so what are the potential causes of this type of knee problem? As I say, at this point, if you are thinking this is what you've got, I would definitely get someone to have a proper look at it because there are so many different issues it could be. You want to know that you're targeting the right tissues. It could be the kneecap and it could be this lateral IT band. But what can cause these symptoms? Tightness in the calves, depending on your movement pattern, if it is related to running, foot position and foot posture. So if you're flat-footed, that can change the biomechanics and how they're working through the knee. Tightness in the quads or hamstring area. The IT band, which should be tight, that's its role, but obviously can have added or unusual tension put through if the hips are tight through either the glutes or the hip flexors. We're sitting at desks a lot, that can really impede how they are moving there and change the load, either onto the kneecap or where the band rubs along the lateral condyle of the knee. So they're all the sort of things that can lead to this, but you really need to understand which one is driving your problem. Okay, so how can you treat runner's knee? In the first instance, you'll need to go and look at a couple of the basics. Rest will help. You really should stop running, at least until you've had an expert look at what's going on and they've okayed for you to continue. Ice will help, particularly if you get the lateral pain here. That will help settle down some of the symptoms there. Go through your stretching for your big muscles, your calf, your quads and your hamstrings, and probably your hip muscles as well, will really start to take some pressure off. And then also look at maybe some strengthening work. But again, you want to target the right areas for this, so it really helps to know which muscles are causing you problems from a weakness perspective before you start that training. Okay, so top tip for this. Top tip, if you are a runner and you have got runner's knee because you've been running, really one of the things that you can look at once you've understood what's happening is to look at your biomechanics of your running. That could be really playing a big part. And what you don't want, having solved the problem, is for it to come back. Find out what the cause is. So if I look here, I've got Alex to help me. If I get him to just do a single leg, so come onto this leg and just do a small knee bend, if your knee's coming in like that, when you're standing on one leg, when you're running, you're going to be doing the same thing. So if I get Alex to hop for me, there we go. And if you're doing that when you're running, every time you're out running, you're going to load the tissues. Now, that can hit a number of areas, but if you've got knee problems and you stand in front of a mirror and your knee comes across that midline when you're hopping, your chances are going to be partly connected to your current knee issue. So once the pain settles down, once you've got everything back on track, get your biomechanics looked at and make sure that you're not just loading up for another problem down the line. Thank you.